Comprehensive genomic profiling is a general term, and I believe it's important to remember that there are many ways of analyzing certain genetic configurations, some of which are outdated. I think the single gene tests that we are using, they may still be FDA approved, but they may not carry the same level of depth of information nor the sensitivity of tests that we can achieve with a next generation sequencing based platform, typically RNA based ideally. So it's a little bit like the Wild West out there because it's not fairly regulated. My recommendation would typically be to vet a lab properly to ensure that at the proper processing places we have a microdissection and tissue analysis performed by a pathologist prior to analyzing a molecular sequence, to look for companion diagnostic status and FDA approvals. Those are all very helpful, not only in confirming that this is actually a valid test, but also may ensure that payers are actually going to be willing to allow us to act on these results. Is that there's not a clear guidance which laboratories are outperforming valid tests which can be trusted. Sometimes it's important to have built up some faith and some confidence into the vetting process. There has been some discrepancies reported between the different lab assays, especially if you take into account the new generation of tests in the liquid biopsy space. This makes this even more complicated. So my recommendation for these tests is to look for companion diagnostic status or for a thoroughly vetted platform that has a large basis of support in the literature to allow us to make proper decisions for patients. Because as I pointed out earlier, this is a very, very important treatment decision tool for patients, and having full faith in this and the results that it provides is of utmost importance.